What is considered a high CRP level? Have you ever wondered how inflammation in your body can affect your heart health? One important marker to keep an eye on is C-reactive protein, often referred to as CRP. This protein is produced by the liver in response to inflammation. When managing long-term hypertension, monitoring CRP levels can provide valuable information about your cardiovascular health. So, what exactly is considered a high CRP level? Generally, CRP levels are categorized into three groups. A level of less than 1 milligram per liter is considered low risk. If your CRP level falls between 1 and 3 milligrams per liter, that is seen as average risk. However, if your CRP level is greater than 3 milligrams per liter, it is classified as high risk. For those living with hypertension, even slightly elevated CRP levels, specifically above 1 milligram per liter, can indicate increased inflammation. This may raise your risk for cardiovascular complications. The American College of Cardiology and the American Heart Association suggest that a CRP level of 2 milligrams per liter or higher could be a potential risk factor for heart attacks and other cardiovascular events. When CRP levels rise significantly, often above 10 milligrams per liter, it typically points to an acute infection or a serious inflammatory condition rather than just chronic cardiovascular risk. This is important to note during regular checkups for hypertension management. Monitoring CRP levels is beneficial as it helps identify patients who might be at a higher risk for vascular stiffness, atherosclerosis, and damage to vital organs. Regular testing of CRP can guide healthcare providers in making informed treatment choices, ensuring that inflammation is managed effectively alongside blood pressure. If you have hypertension and your CRP level is above 1 milligram per liter, your healthcare provider may suggest lifestyle changes or additional therapies to help reduce inflammation and lower your cardiovascular risk. In cases where CRP is very high, further investigation is necessary to rule out infections or other serious health issues. Understanding and tracking your CRP levels can be an essential part of managing hypertension over the long term. It helps in reducing the risk of complications related to high blood pressure. So, the next time you have a checkup, don't hesitate to ask about your CRP levels and what they mean for your health.